Am I pregnant? Okay, that question. It can really send your mind racing, right? Full of hope, maybe some nerves, a lot. Our bodies send it all these signals. Some are super clear, others are, well, kind of confusing. And when you're in that waiting phase, you just want answers, like now. So today we're going to dive deep into those very early pregnancy signs and that crucial waiting time. We want to make sure you have clear, reliable info, and we're drawing from medically reviewed sources like BabyCenter.
Exactly. Our goal here really is to unpack those common early signs, help you figure out, what's just your body doing its normal thing versus what might be an indicator, and also get into the science behind that 2-week wait. We want to give you a factual, easy to grasp picture.
Okay, let's get into it. A missed period, that's usually the big one people think of first. And yeah, sure, it's often the most obvious clue. But, and this is interesting, it's not always the very first thing you'd notice. Especially, if your cycles aren't like clockwork.
That's a really key point. Pregnancy symptoms are just so subjective. They vary hugely from person to person, and even for the same person from one pregnancy to the next, it can be different. Some women say they feel changes maybe within a week or two of conception. Others, they might not notice anything for months. Actually, the data shows about 50% of women reported symptoms by 5 weeks pregnant. That goes up to 70% by 6 weeks, and then 90% by 8 weeks. So it really shows how personal this is.
Wow, 50% by 5 weeks.
Yeah.
So some people are feeling things really, really early.
Yeah.
So, okay, besides the missed period, what are some of those other maybe more subtle signs that can pop up early on?
Well, one that often surprises people is needing to pee more often, frequent urination. And it's not just that you drank a lot of water, it's actually hormonal changes, increasing blood flow down to your kidneys, so your bladder just fills up faster. You might find yourself running to the bathroom way more than usual.
Okay, that makes sense. And it's not just the bladder working overtime, is it? I hear so much about the fatigue, like real fatigue.
Oh, absolutely. That intense exhaustion. People often describe it like hitting a wall. And that's directly tied to your progesterone levels shooting up really fast. Progesterone's working hard to support the early pregnancy. The good news, usually, is that this deep tiredness tends to get better in the second trimester. Though, fair warning, it can sometimes come back later on.
Right. So exhaustion. What about physical things like breast changes?
Yes, definitely. Breast changes are very common early on. They can get really sensitive, maybe swollen, sore, a bit like before your period, but often like noticeably more intense. And similar to the fatigue, this sensitivity often eases up after the first trimester as your body kind of adjusts.
And then there's the one everyone knows, or dreads. Nausea and vomiting.
Yeah.
Morning sickness, which isn't always in the morning, is it?
Not at all. That name is such a misnomer. It can honestly start as early as 2 weeks after conception. And yeah, it can happen any time, day or night. And while it's rough, it doesn't actually harm the fetus, but it can really mess with your daily life. Thankfully, there are ways to manage it, treatments available, and yeah, sometimes it brings friends, like indigestion, suddenly hating foods you used to love, or semper-powered sense of smell, even a weird metallic taste in your mouth, or producing more saliva. It's quite the mix.
A metallic taste, that's one I hadn't heard much about. Wild. Are there other, maybe less common symptoms that might show up?
Yeah, there can be. Constipation is actually pretty common. Again, progesterone is the culprit. It relaxes your digestive tract, slows things down. Mood swings are another big one. Those powerful hormones are affecting neurotransmitters, so your emotions can feel all over the place. And abdominal bloating can happen too. Hormonal changes, again, feels a bit like PMS for some people. All these things, the big ones and the smaller ones, they're basically driven by that surge in pregnancy hormones, especially HCG, human chorionic gonadotropin, plus estrogen and progesterone ramping up.
Okay, now let's tackle something that causes so much confusion. Spotting or light bleeding. It feels totally wrong, right? Seeing blood when you're hoping you're pregnant. But it's actually not that unusual. About, 1 in 4 women experience some bleeding in the first trimester.
Exactly. And this is where understanding implantation bleeding is really important. This is specific. It's light bleeding or spotting that can happen about 7 to 14 days after fertilization. It's when the tiny embryo, the blastocyst, nestles into the uterine lining, which is rich in blood vessels. Sometimes it breaks a few tiny ones. It's usually super light, lasts maybe a day or 2, 3 days max. And the color is key. It's typically light pink or maybe brown, kind of rust-colored. It's never bright red, like a period. And it's too light to have clots. Critically, you cannot have a proper menstrual period when you're pregnant. Those hormones stop it.
That distinction is so crucial. So if you're listening, how can you try to tell the difference? It sounds tricky, but there are clues.
Absolutely. Let's break it down. 4 main things to compare. First, amount. Implantation is just spotting, maybe needing a liner at most. A period needs a pad or tampon, right? Second, length. Implantation is short, like 1 to 3 days. A period usually lasts 3 to 7 days. Third, color. Implantation is that light pink-brown rust. A period is usually bright or dark red. And fourth, clotting. Implantation bleeding pretty much never has clots. A period often does.
Okay, that breakdown is super helpful.
Yeah.
And sometimes people mention cramping with that spotting. Is implantation cramping a thing?
It can be for some women, yeah. Usually it's very mild, like a dull ache, maybe a little twinge. You'd feel it low down in your abdomen, kind of in the middle, or maybe your lower back. It's different from ovulation pain, middle schmerz, which happens earlier and usually just on one side. But it's also really important to say, not everyone gets implantation bleeding or cramping, so not having it doesn't mean anything, and having it isn't a 100% guarantee either. It's just one possible piece of the puzzle.
Right, just one more signal maybe.
Yeah.
So after considering all these potential signs, what does it mean when you're in that waiting phase? We're talking about the famous, or maybe infamous, 2-week wait, the TWW. That time between ovulation and when your period is due, it can feel like forever, and every little thing feels significant.
Yeah, let's clarify that timeline. So ovulation happens around day 14 of a typical cycle. If fertilization happens, the embryo implants about 6 days later, maybe around day 21. So you're technically pregnant then. But, and here's the frustrating part, you won't usually know for sure until about 2 weeks after you ovulated. That's because the hormone the tests look for, HCG, its levels were generally just too low in your urine during most of that TWW to show up on a home test.
Ugh, the waiting game. It can be such a mental roller coaster. So while you're stuck in this TWW limbo, what can you actually do to feel a bit more in control, maybe manage the anxiety?
There are definitely positive things you can do. First, if you're not already, start taking a prenatal vitamin. Make sure it has at least 400 micrograms of folic acid. That's super important for early development. Try to eat well, stay active. The general advice is about 150 minutes of moderate aerobic activity a week. And if you haven't already, maybe think about a preconception checkup with your doctor. Just good preparation.
Okay, that's the positive to-do list. What about the don't-do list during the TWW? Any common traps?
Oh, definitely. Number one temptation. Don't test too early. You really risk getting a false negative, which is just upsetting, or maybe a faint, unclear line that just makes you more anxious. Also, it's wise to avoid alcohol, smoking, and marijuana during this time. We don't fully know the impact before implantation, but we know they're harmful once pregnancy is established, so best to steer clear. And easier said than done, try not to let the stress completely take over. There's some thought that high stress could potentially impact conception, though the link is complex.
So even if you are experiencing some of those early signs we talked about, during the TWW itself, they're likely quite subtle.
That's generally true, yes. If you feel anything during the TWW, it's often non-specific stuff like bloating. Simply because your hormone levels haven't climbed that high yet, you might get implantation spotting or more frequent urination right near the end of the 2 weeks. And maybe, just maybe, nausea could kick in right around the time your period is due. But honestly, no symptoms doesn't mean you're not pregnant, and having symptoms doesn't confirm you are. It's just variable.
Which brings us to the big moment, actually taking a pregnancy test. You see those tests promising results days before a missed period, but based on what you said about HCG, accuracy is really highest on or after the day you expect your period, right? Why that timing?
It really boils down to those HCG levels. That hormone doubles roughly every 2 to 3 days in very early pregnancy. Waiting until your period is due or even a day after just gives your body time to produce enough HCG for the test to reliably detect it. And yeah, testing first thing in the morning is usually recommended too because your urine is more concentrated then, which can help pick up lower HCG levels.
Got it. Okay, so you take a test, maybe it's positive, maybe you have spotting. When does this shift from wait and see or call the clinic during office hours to this needs urgent attention?
That's a really crucial question. Knowing when to seek medical help is vital. First off, any bleeding or spotting during pregnancy, even if it seems minor or stalks, warrants a call to your doctor or midwife. Just let them know. It's often nothing serious, but it always needs checking out. However, and this is the important distinction, you need immediate medical care, like call 911 or go straight to the ER if you have. Heavy, bright red bleeding, severe pain, especially in your abdomen, pelvis, or shoulder tip pain, that's a classic sign of ectopic pregnancy, or significant cramping or contractions, feeling dizzy or faint, lightheaded, having a fever or chills, or any signs that feel like preterm labor. Don't wait on those. They could signal something serious like an ectopic pregnancy, which is a medical emergency, or other issues like miscarriage, molar pregnancy, infection, things that need immediate attention.
That's such clear guidance, differentiating between calling your provider and heading straight for emergency care. It's empowering. So yes, early pregnancy bleeding is common, and often it turns out okay, maybe it's just cervical sensitivity or fibroids or hormonal fluctuations, but the bottom line is always get it checked by a professional. Always. To rule out serious problems and make sure you and any potential baby are safe and healthy.
Exactly. We've covered a lot of ground today, from spotting those very early, sometimes confusing body signals to getting through that anxious 2-week wait, and knowing when to test and, crucially, when you need to reach out for medical advice. Just remember, every single pregnancy journey is different. Feeling symptoms or not feeling them doesn't really predict the outcome. The aim here is just to give you solid information, help you feel informed so you can move through this time with hopefully a bit less uncertainty and more informed anticipation.
Absolutely. It's been a real deep dive into signals that can feel so minor but mean so much. Just consider how understanding these subtle clues can shift that feeling of uncertainty towards feeling more prepared, more aware. It really makes you think, doesn't it? What other seemingly small signals from our bodies might be telling us important stories about our health that maybe we just overlook day to day? Something to ponder. Keep exploring. Keep asking questions.